Welcome back to SUPERSTAT, where we talk laboratory medicine in 20 minutes or less. I'm one of your hosts, Dr. Melody Boudreaux Nelson, and today I want to talk about something that sits deeper than policy, deeper than a visibility campaign, and honestly, deeper than frustration. I want to talk about storytelling. Because if we're honest, it's one of the things, to get upset when the media misrepresents laboratory medicine and pathology. It happens all the time, and I'm sure it gets everyone's blood boiling. Oh, but that's one thing to cringe, right? When we're reduced to a background prop or a punchline, or even some version of a character that's smart but overly detached. And yeah, it can be frustrating when the profession we know to be so deeply human gets flattened into a stereotype. However, it's another thing for us to laugh about it, roll our eyes maybe, but still never set the record straight. And that part is on us as a community. And so the truth is, humor always lands because there's something real buried inside of it. Most jokes are laced in truth. And in the same way, most medical stories that you see on television, whether that be ER or Grey's or The Good Doctor or The Pit, right? Whether we show up in television, most medical stories in film, news headlines, or even casual conversation, they are rooted in real life care, real life tension, real life uncertainty, and real life people. So when laboratory medicine is left out, or maybe oversimplified or misunderstood, it doesn't happen in a vacuum. It happens because our stories haven't been told loudly enough, clearly enough, or even often enough. And maybe that's understandable. Maybe part of the reason we hesitate is because many of us have been conditioned to believe that our work should speak for itself, that accuracy should be enough, precision should be enough, results on time should be enough. But in today's world, if no one understands the story behind the work, then they often fail to see the value of the work at all. And I think many of us in the laboratory and med and pathology arena, we wrestle with the same internal tension. We know what we do matters. We know patients are impacted by our decisions, our vigilance, our expertise, and our judgment. We know care changes because of what happens in the laboratory. And yet, when it comes time to talk about it, we hesitate. And we need to reflect on why that is. When I sit here and think through that, I think maybe because we feel like we're over dramatizing our role, or we don't want people to think that, right? Maybe it feels self-important and makes us feel awkward. That's not really our personality. That's not how we want to be known. Maybe it feels like we can't point to a bedside moment or a patient holding our hand or this like cinematic scene of gratitude or stress and like high stakes that we see so often in television. And somehow that makes our care less visible and maybe less worthy of being seen. And that's really the lie that we have to challenge, right? I mean, this is the point of today's podcast episode is really to kind of talk about the fact that not all care looks the same. Some care is quiet. Some care is highly technical in medicine. Some care happens before a diagnosis even has a name. Some care happens in the background, in the verification, in the troubleshooting, in the critical call, in the quality check, in the moments when something doesn't look right and someone in the lab refuses to let it pass them by. And that's care. And it's worthy of language. It's worthy of visibility. It's worthy of a story. If we want the public to understand laboratory medicine, if we want policymakers to recognize our value as we look toward the shift of value-based medicine and where we're going, if we want the media to portray us more honestly, if we want future generations to see themselves in our profession, we cannot keep insisting on visibility while remaining silent in who we are. And so that's really my challenge to you. And what I want to challenge you to think of storytelling. It's not just an extra thing. It's not just fluff. It's not self-promotion. It is a form of translation. It's how we help people understand that behind every result is a professional who cared enough to get it right. Behind every diagnosis pathway is a system of expertise. Behind every routine test is an infrastructure. There's some clinical judgment and often someone catching what others couldn't see. And let's be honest about something else. Storytelling takes bravery and it takes a human component and even reflection in dealing with our own traumas in order to convey the message we want to convey. And stories mean stepping out from behind the safety of technical language. It's really hard. to allow people to see that our work is not only intelligent, but we are emotional human beings who experience things not only analytically, but deeply human, not only scientific, right, but deeply compassionate. And that feels vulnerable. And when you are ready, maybe don't feel safe, like you're in a safe environment where you can share without being taken as like over dramatizing or maybe like overstating what you do or those types of things. It can be really hard to let them also see that emotional capability that you have or that you possess relating to your patient care, especially in a profession that has so often been taught to stay in the background. Don't make too much noise, don't ask for too much attention, don't appear as though you're making yourself bigger than you should be. And I would say to that, like telling the truth about our work, it's not exaggeration. It's not ego. It's not performance. It's a form of advocacy. And more than that, it's an act of care and just talking about the fact that we care. Telling our stories, isn't just a way to defend the profession. That's not what it's for. We shouldn't be argumentative in that way. Our stories should just be what our stories are. It's a way of helping people understand their own care journeys by seeing the lens that we help them through. It can also help other clinical teams recognize where laboratory medicine lives inside patient outcomes and helping the next generation find a place for themselves in science and healthcare. It's a uniquely human experience to tell stories. Where I grew up, they say, let me tell you a good one, right? I grew up in the boot. And I always say that storytelling is how I learned most things as a child. Like my family tells stories, and we have to tell stories to help others learn about us. But storytelling isn't the only uniquely human thing. Care is uniquely human. And if we want to say we want visibility, then we can't separate the two. We cannot want to be seen without being willing to speak up. And we can't want better representation without helping shape the narrative. We cannot keep wanting and waiting for someone else to tell our story correctly if we've never even been brave enough to tell it ourselves. And so maybe that's the challenge. Not just to be frustrated when the media gets it wrong, not just to critique the stereotypes, not just to laugh at jokes and move on, but to replace the shallow story with a truer one, a fuller one, a braver one that shows the depths of our care, and one that honors the precision and the humanity of what we do. One that reminds the world that laboratory medicine and pathology are not removed from the patient's story. We're an integral part of it. And the more we tell that story, the harder it becomes to overlook. I hope this episode challenged you to think a little bit more about how you could tell your story. And I just want to thank you for joining me on this episode of SUPERSTAT. If this message resonated with you, maybe this is your sign to tell one story, just one, about what this profession really looks like, what it really holds, and why it matters. Because change happens when truth is spoken out loud. And this profession has too much heart to remain silent.